Good afternoon, everyone. Thanks for joining us for this COVID-19 vaccine update with Dr. Cara Christ, Director of the Arizona Department of Health Services. A reminder that this session is on the record and we are setting everyone up to record. After a presentation, there will be an opportunity for everyone to ask questions. And now, just hours before throwing out the first pitch at the Arizona Diamondbacks home opener, here is Dr. Cara Christ.
Good afternoon, everybody, and thanks for joining us today. We hope you've had a great week. I know I saw many of you on Monday when we opened up our new facility. I'm going to go through the same presentation that we've gone through with the updated data, and then we'll leave time to answer questions at the end. So after reaching a peak of about 65,000 cases the first week in January, we have seen a steady decline over the last 13 or so weeks. We have reached a plateau and are starting to see slight increases in the number of cases per week. This is anticipated as we bring people back together, but we want to remind everybody this is a great reminder to make sure that you're wearing masks and staying physically distanced and getting the vaccine now that it's everybody's turn. We are still seeing decreased hospitalization use in our ICU beds, our med-surg beds, and ventilators, as well as in our COVID-like illness, which is what we want to see here in Arizona. Here is the epi curve that we show you every week. We did not add any new milestones on that, but you can see that we have had a significant decrease since the beginning of this year, and we continue to remain low. We have reached a plateau, and we will continue to monitor that as we move forward. And we're seeing the same thing with our percent positivity. So after reaching a peak of about 19.4% positivity back at the end of 2020 and the beginning of 2021, we've seen a steady decrease, and we are starting to see our percent positivity plateau. Again, for those that aren't familiar with this graph, this is a little bit different than the graph that you see on our dashboard. This is the total number of tests that are performed. The dark bars are the tests that are performed in unique Arizonans, and the gray bars are repeat tests in Arizonans that have already had a test. And you can see as the weeks progress, we get more and more repeat tests reported here in the state. I'm going to move on to vaccine distribution. All counties now have moved to vaccinating age 16 or 18 and above. Pfizer has become more widely available throughout the state with the addition of additional state pods and more pharmacies that have access to the Pfizer vaccine, including CVS. And so that's a really promising development. We continue to get vaccine here in the state. Next week, we're anticipating about 340,000 additional doses. You will see that there's a significant decrease in the amount of J&J or Janssen vaccine that we're receiving this week compared to last week. We anticipate that this will stay baseline for the next few weeks as Johnson & Johnson continues to ramp up its supply. However, we are receiving level amounts of Pfizer and Moderna, and those are still being allocated to our county health partners for distribution within the counties. We have hit over 3.9 million doses of vaccine administered in Arizona. That's to almost 2.5 million Arizonans. We anticipate hitting 4 million vaccines this week, so we're very excited about that progress. And almost 35% of Arizona's population has received at least one vaccine. So that's really great. We continue to monitor that as well. We've added additional vaccine administration sites, so we're currently above 1,200 providers around the state who have received vaccine supplies and vaccine, and that includes a whole host of different types of healthcare providers. We've had over 1,500 long-term care facilities across the state receive vaccine through the CDC Long-Term Care Pharmacy Partnership Program. They are anticipating wrapping up mid-April with all of their visits to our long-term care and assisted living facilities. So again, that was a very vulnerable population that we were prioritizing here in Arizona, and we're glad to see that that program was so successful. We also have over 630 pharmacies that are receiving vaccine supply from the Federal Retail Pharmacy Partnership Program. And this week, we have added Bashes and Food City pharmacies to the list of pharmacies that are receiving vaccine. Just to run through this again, how do you make an appointment at a state pod? There's two ways that you can do that. You can either go to podvaccine@azdhs.gov. We release new appointments every Friday at 11, but then we also release appointments based on cancellations and no-shows and capacity at the sites on a daily basis. You can learn how to set up your account and make an appointment through our patient portal guide. Or you can call 844-542-8201. That will connect you with someone who can assist you with scheduling, and that is available in both English and Spanish. The local pharmacies are a little bit different. They do not schedule appointments through our podvaccine@azdhs.gov website. So you will want to check their eligibility. You can find the websites to make those appointments at azdhs.gov/findvaccine, or you can go directly to their websites. If you've got a pharmacy in your neighborhood that you want to go to, you can go directly to their websites to schedule that appointment and see availability and which types of vaccine they are offering. In an exciting development, our federal retail pharmacies, community health centers, and dialysis clinics have expanded eligibility to age 16 plus. And so you'll be able to find the vaccine at over 630 different pharmacies in Arizona. That includes Fry's, Albertson, Safeway, Walgreens, CVS, Walmart, Costco, and now Bashes and Food City. They are receiving limited supplies of vaccine at this time, but the federal government continues to increase the amount of vaccine that they are sending to the pharmacies. And so continue to check. They also are utilizing 65 federally qualified health centers in Arizona to get a federal allocation of vaccine. So your local community health center may have a vaccine there. When we are at full capacity, we'll have more than 1,000 retail pharmacy, health centers, and dialysis clinic locations once it's fully activated. Like we said, the CDC long-term care program will be completed by mid-April of 2021. This is that CDC Pharmacy Long-Term Care Partnership Program, where Walgreens and CVS went on site to prioritize vaccinating the staff and residents of our long-term care facilities, knowing that those patients were at very high risk, not only because of their age and health conditions, but also from living in a congregate setting. Over 137,000 shots have been administered here in Arizona to this vulnerable population. And if a facility didn't register or didn't participate but are interested in still connecting with CVS and Walgreens, they do have additional resources available on their website that facilities can contact them to see how they can continue vaccinating their residents. All right, some exciting announcements for both this week and next week. On Monday, you are going to see, probably Monday afternoon, you will see a new look and feel to our COVID-19 webpage at azdhs.gov. We're very excited. We've been working on this. The team has been working on this to provide a more streamlined and easier to access the information on our website. So be looking forward to that on Monday. We also will be releasing a new PSA this coming week, and we wanted to give you guys a preview to that. I'm going to see if I can play. I'm just going to tell you I'm not technologically savvy, so I might need to look at the team. Here we go.
The COVID-19 vaccine is here.
And it's our best shot at returning to normal. But don't just take my word for it.
Take mine. Get your shot.
It's safe and it's free.
For everyone, no matter who you are.
In every community.
Arizona is leading the charge in distributing the COVID-19 vaccine.
Join the millions of Arizonans who've already been vaccinated.
It's our shot to fight COVID-19.
So roll up your sleeve and get vaccinated.
So that should be starting to play over the weekend or Monday. You'll start to see that on social media as well as on some of our local stations. What we were using the research that we had done that individuals would find trusted sources for vaccine. Now that it's everybody's turn, we want to make sure that everybody knows that they should get vaccinated. It's safe and effective. And as we continue to roll vaccine out here in Arizona, we want to get as many Arizonans vaccinated as we can. So we're very excited about the release of that public service announcement. Our state vaccination sites have administered now over 1.1 million doses of vaccine, and over 700,000 doses of that vaccine have been administered at State Farm Stadium since it opened January 11th. And as I'm sure everyone's familiar with, we are currently transitioning our state sites to indoor locations as we continue to increase vaccination capacity. So I'm going to talk about the transitions because I know that there's been a lot of them. So on April 5th, we transitioned State Farm Stadium from a 24/7 to overnight operations that operate from 5 p.m. to 9 a.m. That will continue until April 23rd at 9 a.m. And then the Glendale pod is going to move and reopen at Gila River Arena at 12 p.m. on Friday, April 23rd. We are starting to schedule second dose appointments for individuals who are getting their first dose at State Farm. They are being scheduled their second dose at Gila River Arena. For the Phoenix Municipal Stadium, Phoenix Muni operates from 7 a.m. to 5 p.m. That will end operations on Sunday, April 11th at 5 p.m. when we wrap up that day. And the ASU pod will then reopen at Desert Financial Arena at 7 a.m. on Monday, April 12th. And so we're very excited about being able to move our team out of the heat and indoors where it's safer for our staff and volunteers and patients. For our Chandler Gilbert Community College, that site ceased operations on April 3rd and then transitioned successfully to the new Southeast Mesa pod location at Dexcom. That started on April 5th, and they have been in operation since then. And the University of Arizona does have both an indoor and a drive-through site. They continue to monitor the weather and their operations and can transition completely indoors by May if they need to. And so this is just a summary, if you wanted to use it, about what the 3 pods that are transitioning to indoors, when they are going to transition, and the date that they will be operational at the new indoor site. Just as a clarification, the Desert Financial Arena and Gila River Arena will be a walk-up vaccination site. The drive-through will remain at the Southeast Mesa Dexcom. And so that's one thing that we want to make sure that we're clarifying to patients as we're making appointments for those areas, is that will be a walk-up site. Many of you joined us on Monday for the kickoff of the Dexcom indoor drive-through. So this is the new Southeast pod that took over in place of the Chandler Gilbert Community College site. This will be open daily from 7 a.m. to 9 p.m. We added an additional 4 hours onto the sites. Those appointments were loaded today and offered. And this is a partnership with Dexcom, the City of Mesa, Walgreens, ASU, and other state partners. And so we continue to monitor that. And as that site increases efficiency, we'll continue to add additional appointments at that site. Here's the ASU Desert Financial Arena. That's going to transition this coming Monday. So it will be open daily from 7 a.m. to 5 p.m. and offer about the same capacity as Phoenix Muni, but it does have a significant ability to increase capacity even more. This is the continued partnership that we had out at Phoenix Muni with Arizona State University, Arizona Complete Health, Walmart, and then other state partners. And the Glendale pod at Gila River Arena. This will transition indoors starting on April 23rd. It'll be open 7 a.m. to 7 p.m. and offer up to 10,000 appointments per day initially, but does have the ability to significantly increase if the demand requires. So this is a continued partnership. The Arizona Cardinals are going to stay on as partners along with ASU, Walgreens, the City of Glendale, and other state partners. And we anticipate that we will hit 1 million shots with our Glendale pods by May. We made the announcement about the Westworld vaccination site earlier this week. This is going to open on April 22nd and will be open daily from 7 a.m. to 5 p.m. It'll offer an additional 3,000 to 4,000 appointments per day, again with the ability to scale up. This is in partnership with Cigna, the City of Scottsdale, and other state partners. And you're all familiar with our University of Arizona vaccination site. So that may transition to the indoor walk-up clinic based on their heat plan. They continue to be open from 10 a.m. to 10 p.m. They've been offering about 4,000 appointments today. We continue to have that partnership with the University of Arizona, Walgreens, and other state partners. And if there are individuals looking for additional appointments, we've had open capacity every day at the U of A vaccination site. And then our Yuma Civic Center vaccination site, that transitioned to a state-supported site on March 29th. Again, they're open from 7 a.m. to 5 p.m. and have the capacity to offer up to 8,000 appointments per week. Yuma Civic Center does continue to have open appointments and availability to provide vaccine, and that's done in partnership with Yuma County, the City of Yuma, Yuma Regional Medical Center, and ASU. And the exciting news that we announced today is we'll be launching our Northern Arizona University vaccination site. That will open on April 19th. It'll originally be open from 7 a.m. to 5 p.m. and offer up to 8,000 appointments per week, with the ability potentially to expand hours if needed. So the partnership is with Coconino County, Northern Arizona University, Northern Arizona Healthcare, Premier Medical Group, and other statewide partners. This weekend, we are partnering with Ability 360, the ARC, the Arizona Commission for the Deaf and Hard of Hearing, Special Olympics, and some of our state partners and Passport Health to put on a vaccine event for our disability community. That will be by appointment only, and that you can find the appointment by going to Ability 360's website. We'll be doing this week or this weekend for first doses, and then returning in 3 weeks to give them their second doses. And in Arizona, we've been using a local allocator model that was aimed to ensure that we were equitably distributing vaccine at the local level. Our local health departments are the experts in their community and know where and who should be vaccinated within each of their communities. So they continue to assess the vaccine needs and partner with community-based organizations to launch events that will help increase vaccine access, get these into the communities where they need them, improve equity in our underserved communities. And so we continue to thank our partners who are providing some of these, including Chicanos por la Causa, Equality Health, Arizona. They have been doing great work over the past few weekends to initiate community-based pop-up events. And with that, I'll thank you, and I will be happy to take any questions.
Thank you, Dr. Christ. We will try to get through as many questions as we can by 2 o'clock. First up is Cameron.
Hi, Cameron.
Hi, Dr.
Oh, there
Chris.
you are.
Just hoping to talk to you a little bit about what we see on the horizon, specifically with vaccine hesitancy. Obviously, you're going to move me into kind of a segment of our population as we begin to vaccinate more people who you might be convincing people to come and get vaccinated. Obviously, we see the PSAs. how will you start targeting those underserved communities more? We've seen studies that show that clearly income levels have a big, show big factors when it comes to being hesitant, so lower income folks tend to be more hesitant. We're also noticing that those with different ethnic backgrounds beyond, Anglo-Saxon white have shown hesitancy, not only getting themselves vaccinated, but their children who will become a critical population to get vaccinated as well. How are you going to do that? And can you explain to me a little bit about that? And I'll have another question after.
Yeah, sure. So, that's a great question, and it's something not only in COVID that we deal with, but in other vaccination types as well. But there's a multi-pronged strategy that we are looking at. So, you saw one of the PSAs today. We're really focusing on some of those influential leaders in those communities to, help spread the message, to identify trusted community leaders that we can work with to also spread that message, and then allowing those messages to be spread by other organizations. So organizations can actually go onto our website and utilize the vaccine campaign assets and brand them as their own, so that they can disseminate that as well. And we've been partnering with some of the community leaders as we've been developing these to get their feedback and make sure that the messages resonate. But then we're also going to be working with our local county health departments to make sure that we're offering pop-up vaccination events in those communities, that they are put on by trusted community providers. And as we get more and more vaccine, we know that the research showed that a lot of individuals said that they would trust their healthcare provider if their healthcare provider recommended that, or somebody that they knew that got vaccinated, encourage them to get vaccinated. What you'll see is as the vaccine becomes more plentiful, there's going to be a shift. And we, as the state, will not be allocating that vaccine anymore. Providers will be able to directly order that. And just like they do, it can go to their offices. The pharmacies will have more supply. And so it'll be available where people normally receive their health care and get a lot of trusted advice and guidance and can ask their questions one-on-one. That will help with that as well. And so we'll continue to, develop that strategy. We know that's what phase 3, when we talk about phase 1 is which the demand doesn't meet, the supply doesn't meet the demand. Phase 2 is when the demand meets the supply. And then phase 3 is when you've got more supply than demand. And so the strategies do change, and we'll be reaching out
as to how that money will be spent, and will some of it, as some child and parent advocacy groups who I've spoken to, will some of it be going to educate parents to vaccinate their children?
Yeah, so you're right. We're receiving some funding from the Centers for Disease Control to ensure health equity with vaccination. And so some of those efforts will be some of the things that we've been doing in the community. So like our 85009 pilot, we will be expanding that to South Phoenix, to areas of Mesa, to areas in southern Arizona, so that we can directly, outreach the yard signs, going door to door, encouraging people to get vaccinated in those areas. And so we'll continue efforts like that, but it will also go to local health departments so that they can partner with organizations in their communities to encourage the vaccination. But that one of the things that we do is we try to put together like toolkits and information. So we currently have a toolkit that helps providers talk to their patients and answer questions about the COVID-19 vaccine. We're always looking at strategies like that. So we would definitely be aiming at, also talking to parents. We do this with measles vaccine, with flu vaccine, and we'll, as we get into that and as a vaccine becomes approved for children, we will be working on messaging to parents as well.
My very last question. So we know that there was a contract, $1 million contract to reach out to people in 85009. We have heard from folks who still kind of feel apprehensive or even feel confused by the process. Many of them are Spanish-speaking folks who live in that community. How else will you tackle that community who is very private, maybe hesitant to even get involved with officials? How will you reach them, especially with that language barrier, and how will that money be used in that community?
So that the other strategy will be working directly with like trusted providers in that area that can do that direct outreach. So that final example on this slide was actually a partnership between Walgreens, Equality Health, I believe Adelante Healthcare, where they set up a pod that not only provided vaccine, but provided testing, provided all sorts of other services that people may need. So the vaccine was just one thing that they were offering, but that's one of those things that's done in the community by healthcare providers that are trusted in that community. So we'll be partnering with our county health departments and those types of providers to get those community-based organizations, and even things like, you know, they can reach out to local churches, like bring your congregation day to get vaccinated on this day, and working with trusted groups to really get that message out there.
Thank you.
Thank you.
Next, I'm going to call on Alexander DeVoyd. I dropped his hand. I got to find him on here. Sorry.
Okay.
Hi.
There you go, Alexander.
Hi.
Hi. So my question has to do with some data that Pima County officials are pointing out. So Pima County officials are pointing out that their contact tracing data show an uptick in people with COVID-19 going to restaurants, bars, and events. And they point out that it's happened since Governor Ducey lifted occupancy limits. Is this expected? Could you put this in any sort of context for me? Does it concern you?
So it is expected that as people come back together, we will see potentially increased cases. And so I don't know, you know, as we continue to get more and more Arizonans vaccinated, that's going to decrease the risk of hospitalization and death. And, you know, everyone needs to make those types of risk assessments whenever they're going out into public, to be around those that, you know, they don't live with. And so anytime you're doing that, you're putting yourself at risk for potentially coming into contact with COVID. And we know that no vaccine is 100%. However, you know, as we're watching what we would anticipate seeing additional cases, what we'll be watching is the hospital usage, as well as, you know, deaths and hospitalization. A large portion of our vulnerable individuals in Arizona have been vaccinated. They were prioritized in those groups, and so that should significantly reduce the hospitalizations and deaths here in Arizona. But just like Pima County, it's something that we continue to monitor as our public health activities.
How much weight would you give to the lifting of the occupancy limits for explaining why they're seeing more COVID-19 COVID-19 positive folks self-reporting that they had gone to a restaurant, bar, or event, seeing that uptick since in those types of self-reported cases since the lifting of the occupancy limits?
So that could be that people are going back out to restaurants. I don't know if that had anything to do with the occupancy limits. It also, we ask, when you are contacted by a contact tracer, we ask a large number of questions, like where have you been in the last 14 days? Have you been in any large groups? Have you attended these different types of facilities? People may be, especially if they're getting vaccinated, maybe going out to restaurants more if they didn't feel comfortable. And so it could be a combination of factors that are resulting in people kind of returning back to normal, including vaccination strategies. You know, they feel safer. But we would still encourage people, if you're going out, make sure that you're staying physically distanced and wearing a mask whenever you're with people that you don't live with.
Thank you so much.
Thank you.
Howard Fisher.
Hi, Howie. I don't hear you.
Takes Howie a while to unmute himself.
Sorry about that. Anyway, so let me start off with a technical question. This 35% vaccinated, is that total state population, or is that just adult population?
So that's the total state population. So that's not the adult population. That's just using the baseline population. And that's just people who've gotten first dose. So that's not fully vaccinated.
Understood. Secondly, we've seen some stuff nationally about some reactions to Johnson & Johnson. Have you seen anything here? And are you have any concerns about J&J?
You know, we've been following what's been going on in the other states. Right now, we haven't seen events like that here in Arizona. At least they haven't made it up to me just yet. I'm not aware. But it is something that we do monitor through our VAERS reports that CDC gets. Right now, we would still encourage you to take any of the vaccines that are available to you. If you know, we're encouraging everyone to get vaccinated, and Johnson & Johnson is one of those that we would encourage you to get.
Okay. And then finally, there's been an issue both state and nationally about, I guess what you call a COVID passport. The idea of having something that would be recognized, whether it's for an airline, whether it's a restaurant, or whatever. What's your thought on COVID passports as far as useful, or is it starting to get intrusive in terms of even HIPAA information kind of stuff?
Yeah, and that's something that we're kind of looking at here, and that's a great question. You know, I think that if Arizonans want to have access to that vaccine, I think that, or that vaccine history, I think that there should be a very easy way for Arizonans to do that. We would like to facilitate that. But not as a requirement into events or those types of things. So while we would want to make access to that, I still have my my paper card from when I got my second MMR, and I carry that around with me. It would be nice to have an electronic format of some of that, but we are not looking here at the department as making that a requirement.
Do you think that retailers should be able to require it? In other words, if I'm running a restaurant, a bar, I don't know, that they should be able to say, we're not going to let you in unless you show you've been vaccinated?
You know, I don't know that I would make that a requirement for going into a restaurant or a bar, but, you know, business owners do have the ability to implement mitigation strategies. But again, it's everyone's going to have to carry around these cards, and they're going to have, you know, that I think that causes a lot of logistical issues, and so that would not be a requirement that we would put on businesses.
Okay. Would you be willing to, if you wanted to go in to Fry's or someplace, or you know, go to Crazy Jim's for some salad or something, would you be willing to say, okay, I'm willing to show you my paper, so to speak?
From my own personal standpoint, you know, I'm fine with people knowing my vaccination status. I don't mind. I mean, everyone saw me get vaccinated, even though I'm terrified of needles. So I think, like, from a personal aspect, but there are individuals who want to keep their health information private. And so for things like that are mandatory, like a grocery store and those types of things, there are other mitigation strategies that can be put into place. I don't know that I would require a vaccine proof to go into those types of locations.
Okay, there's my headline. State health chief scared of needles.
Well,
thanks a lot.
And scorpions.
Oh, yeah. Next is Taja in Tucson. Oops, sorry.
Hi there.
Oh, there you go.
Thank you so much. So earlier, Pfizer and Moderna reported that they're effective for at least up to 6 months. And since we're not sure at this point if the vaccines are effective past that, I was curious to know if health officials have even started asking what that process would be like for potential booster shots down the road, say like maybe this fall or winter. Will people struggle to get appointments for booster shots? Will we just kind of go to our doctors or drugstore pharmacies at that point? Curious to know if the state has thought that far ahead yet.
So, you know, that's something that we continue to monitor because, yeah, we've heard that they could be good for 6 months. We've heard that they could be good for a year. Likely by that time is when we would have sufficient vaccine supply, so it would become just like getting your yearly or annual flu shot. It would be available at doctor's offices and pharmacies, and it would be more available in the community than it is right now because of the limited supply.
Okay, thank you.
Welcome.
Okay, next is Bud Foster.
Hi, Bud. I don't hear him.
He's got it.
Hello
there we go.
No. All right, Dr. Chris, thank you very much for doing this. We really certainly do appreciate you taking your Fridays. It really does help us keep up to date on what's going on, so we certainly appreciate you doing this. You said at the very top of this, and you've already been asked about the slight uptick and the slight increase. I did a piece on this yesterday and was told that it is something to be concerned about, but not alarmed about. At this point in time, would you agree with that assessment, and why would you agree with that assessment?
I would agree with that assessment. You know, anytime we see an increase in the number of cases or in our percent positivity, you know, it is cause for concern. We want to make sure that Arizonans are getting vaccinated and taking those steps to prevent COVID-19. I don't know that we're at a point where we are alarmed. I would agree with that assessment. We anticipate seeing cases as people come back together. And as you know, we've got schools returning, we've got people going back to extracurricular activities, and so we will see an increased cases. I don't know that we're so concerned about that as long as our hospitalizations and deaths remain low or steady, and we don't see a significant increase in that, because we really want to make sure that we've got that hospital capacity and that we're protecting Arizonans. But cases, if somebody's asymptomatic or has mild cold-like symptoms, that wouldn't be something we were concerned about. We would be concerned if that individual gave it to, you know, their grandmother or grandfather. But with vaccine increasing, hopefully those vulnerable individuals have all been vaccinated and are taking those same precautions.
My assumption is you would be alarmed if you saw a big jump instead of what we are seeing right now, which are slight increases.
Yeah, if we saw a big jump, we'd be taking a look at, you know, the age groups we were seeing it in and the areas that we were seeing that in, and really trying to target to see what we were, you know, what the impacts of that would be. And so, but right now we're seeing very, very small increases, and we've kind of plateaued on our descent.
And then just one final thing. The Attorney General, Mark Brnovich, issued a ruling this week that the governor does not have authority to rescind the Pima County mask mandate, but your office does have that authority. My question is will you use that authority, or will you just leave the Pima County mask mandate in place?
So I don't see us using that authority at this time. You know, where we will just allow Pima County to continue doing what they're doing. We're focused really on our vaccination efforts and trying to get out as much vaccine as possible.
But you left the door open as a possibility in the future.
I think it's one of a number of authorities that the health department always has. I don't know that we would consider using it at this point in the pandemic.
All right, Dr. Chris, thank you very much.
Thank you.
We really appreciate it.
Next is Peter Samore.
Hi, Peter.
Well, Dr. Chris, how much of a blow to Arizona is the loss of Johnson & Johnson shots?
So, you know, we have mostly been working with our Pfizer and Moderna. I think that the reduction in Johnson & Johnson is unfortunate for, you know, trying to reach those hardly reached or underserved areas that it's hard to get that second dose back. But we also were prepared for uneven distribution. We knew that for the first month or two, you know, we'd get some week, and then the next week we might get none. So we've been focusing really kind of those mass planning events with like the Moderna and the Pfizer. But the Johnson & Johnson, as much as we can get, we're happy to take.
I would imagine it'd be nicer if you can get more Johnson & Johnson right away just to get the doses up and so forth. So do we have more vaccine than demand at this point? Or are we evening out in both for supply and demand? Where do you see us right now?
I think it depends on where you are in the state. So I think in some places in the state, the demand, the supply has outstripped the demand. So we have more supply than people who want it. And I think, if you're looking at some of our rural areas, especially like Yuma, we can see that because, we opened up the mass vaccination site and we still have hundreds of appointments available each day at that site. We're going to try to take that vaccine further into the communities, but they're not filling up. And also, as we were monitoring the appointments last Friday, statewide, the University of Arizona pod had available appointments every day. And in addition to those available appointments, they were releasing additional appointments each day that weren't filling. So that tells us that we might be coming to that saturation in our Southern Arizona market. Here in the Phoenix metropolitan area, we did fill up all of the appointments. There were still some call center appointments, but it took longer for those appointments to fill. And some of the last ones remaining were the middle of the night at State Farm. So, which indicate that people still want to get vaccinated, but maybe not to the extremes that they were.
So, as I like to say about Fridays, it's 2 more days till Monday.
Hi guys, I think we're back.
That's too bad, but everything's going so well too.
Oh, goodness.
Do you have more questions, Peter?
We just didn't want Stephanie and Hank to be able to ask any questions.
Oh, somebody mute Howie.
Hi, I think we're back. Are we back?
I think we are.
Wonderful. Okay, sorry, technical difficulties.
It happens all the time.
Did I finish answering your question before we froze, Peter?
I think you did.
Okay.
I think, yeah, I mean, the evening out supply and demand and so forth. And then I guess I can follow, last question I was going to ask, any new variants we should know about, or where are they coming from?
So we've been seeing the variants from California and the UK. I think we did an announcement last week on the South Africa. I think we've got a couple of the Brazil. Other than that, I'm not aware of any newer ones that we've gotten.
Sounds good to me. Thank you very much.
You're welcome.
Next is Brittany.
Hi, Brittany.
Hi, sorry it took me a moment to unmute there. So my question for you is, if churches or community groups want to partner with you to try to get that vaccine out to underserved communities, what do they need to know or what do they need to do if they say wanted to bring vaccines to a church or something like that?
So there's 2 things that I would encourage an organization. If you're a healthcare partner that wants to provide vaccine, make sure that you are onboarded to receive that vaccine through our website, but then reach out to your county health department because they will be the ones allocating the vaccine and working with you to get you the vaccine. If you are a church or community group that is not a healthcare a healthcare provider, what we would recommend is work with your county health department, but also potentially partner with a healthcare partner that can bring and administer the vaccine. The county health departments may be able to partner you with somebody who can provide that vaccine, but if you've got a provider and you've got a specific date, you can then work with the county health department to just get vaccine allocated. And that will happen, that will become more increasingly available as we get additional vaccine into the state.
Great, thank you.
Welcome.
Okay, next is Sheridan and Flagstaff.
Hi.
Hello, this is Sheridan and Plateau from NAZ today. I had a few questions regarding Northern Arizona.
Yeah.
My first one is that Northern Arizona University does already have existing efforts to vaccinate students. So I'm wondering if these new efforts are going to expand on those or replace them entirely.
So what we're going to be doing, this is similar to what we did in Tucson and Pima. Both of those had existing vaccination sites. What we do is we work with them then to expand those efforts. So they'll still be able to continue to provide vaccine at that location to their community. A lot of times we'll work to get them additional vaccines so that they can provide expanded hours or more doses per hour. And we help provide staffing and additional resources so that they can expand upon what they were already doing.
Okay, great. This is Sheridan as well. I'm with Aaron right now. I was just wondering if you could elaborate a little bit on your partnership with Coconino County in putting into effect the NAU vaccination location.
Yeah, so we partner with Coconino County and Northern Arizona University. What we will be doing is we'll be working with them to provide the vaccine. So we distribute directly from the state level to the state operated pods. And then we work with our sister agency, the Department of Emergency and Military Affairs, to make sure that anything logistical that those partners need, if it's staffing, if it's tents, if it's funding, those types of resources, we're able to give it to them and provide a higher capacity and higher throughput through those areas.
Awesome, and one more, just wondering if there are any efforts made to vaccinate and target Coconino Community College students specifically, or if they're going to be going through the county or anything.
So I'm not sure if there are specific efforts. That would be probably a great question for Coconino County. However, anybody is eligible over the age of 16 to utilize the state pod sites. And so if there are community colleges that want to get vaccinated, they would be able to register for an appointment there.
Awesome, thank you.
Welcome.
Next, we have Ethan at Cronkite News.
Hi.
Hello, are you able to hear me?
Yeah.
Okay, Dr. Christ, I appreciate you being able to kind of, sit and talk with us today. I do have a couple questions. I had one more, but it got answered earlier. So I'll go ahead and kick things off here. Off the top of your head, the UK variant that was, I think there were a couple incidences at the University of Arizona, the B117 variant, is that starting to become the primary predominant variant in the state, as I think it seemed to be more infectious or starting to spread? Off the top of your head, if you would know.
Yeah, I don't know if it's become the predominant strain. I know that we are seeing more and more cases of it, but I can have Steve follow up with you on that. So we take a certain proportion of the samples and work with our partners to do genetic sequencing of the variants to identify what variants there are and what we're seeing in Arizona. So it would be a representative sample. And what we have heard about that variant is that it is more transmissible than the current one that we've been dealing with here in the United States. So we continue to monitor. There also may be increased hospitalizations, and so that's really, we encourage everybody to get vaccinated as quickly as possible, because the vaccines are still effective against the variants that we're monitoring.
Got it. And if you don't mind, real quick, I'm going to add a follow-up to what you mentioned earlier about that. With that increased or possibility of being more infectious, is this something you think we should be concerned about, especially with vaccinations rising and all that? Is this something we should be concerned about this time?
I think it's something that we should be concerned about, and I think that it's another indicator for why you want to make sure that when you're out, you're wearing a mask and you're staying physically distanced, and getting that vaccine as soon as you can. Because it is more transmissible, so people are going to be able to pass it to other people much easier. And what you don't want to do is transmit it to somebody who's at high risk for bad outcomes of COVID. We continue to try to vaccinate our vulnerable populations and to get them vaccinated as quickly as possible. But not everybody has been vaccinated, and so you just want to take that into an account.
Got it. Thank you. My next question is about the mandate restrictions. So, Governor Ducey a while ago lifted the mandates, and then I think a number of cities, Tucson starting, and then Phoenix followed. I think Mayor Kate Gallego, she reinstated the mandate. She defied the order. And do you think that all of these restrictions? Do you think the lifting of these restrictions? Do you think it's the right time? Is it too soon? What's your take on all of this?
So I think that Arizonans have done a good job of masking up and staying physically distanced. We still are very low percent positivity rates, low cases. I think that it was the right time to lift restrictions. These were restrictions that were at restaurants and gyms and movie theaters. We still encourage, it is still our recommendation to wear a mask and to stay physically distanced and to stay home when you're sick. However, we're just not going to mandate and enforce that. I still think that it's a good idea for everyone to do that when they are around others they don't live with.
All right, and my final question is a little bit more of a side question, but no one brought it up, so I'll ask anyway. So a report that was released today from the Arizona Department of Health Services talked about the potentially artificially inflated dashboard numbers for the COVID case numbers for Friday, primarily the Gila and then Graham and Navajo counties, saying that about 73 of these cases were positives recorded during, or were taken from tests taken during the fall winter peaks, but were now being recorded with more recent numbers, pushing that number higher than what it may actually be. What's kind of your response to that, your take on that? Is that should this undermine our confidence in the reporting of COVID-19 case numbers, or what's kind of your take on that?
I think it's a really good demonstration that our public health data is fluid, and we know that we're not getting 100% of the cases. There are very few diseases that we get 100% of reports of cases. What had happened was these cases had been tested, but we didn't have the definitive test, or they had been coded as a coronavirus illness, but not specifically COVID-19. There are several different types of coronavirus. And so as we got those test results in and we were able to confirm that it was COVID-19 and not some other coronavirus, then they were added to our counts. And so you're exactly right. 73% of those, I think it was about 625 cases, were from the winter peak, and then the remaining were before that. There weren't any that were recent in March or April. But it is something that we are continuously doing in public health, is we're always looking at the data, we're always cleaning the data and getting additional information. So we know that our data can change, but it shouldn't undermine anybody's view of the data, because we report real time. And so that's one of the things also, as we get fewer and fewer cases, you start to see more of that cleanup, which is why we can have -1 death on a day, or a reduction in cases on a day, because we are continuously doing that.
Thank you once again.
You're welcome.
Okay, next is Lorraine.
Hi, Lorraine.
Good afternoon, Dr. Christ. Happy Friday. I wanted to circle back to a question earlier about vaccine hesitancy. I know some researchers are saying that it's looking like this could be a big problem across the country, especially as the U.S. is expected to reach herd immunity. Is the state still estimating that demand for the vaccine is at about that 55 to 60% number?
So it may be a little bit higher than that. Initially, that 55% number came from some of the community surveys that we had done and some of those feedback sessions. And that was before the data came out and before we had vaccinated millions of Arizonans. We do think that number went up a bit. And so, but I agree. I think vaccine hesitancy will be an issue moving forward. And I think we're going to have to do a lot of community outreach and really encouraging individuals to get vaccinated. This has been a growing trend that we've seen over the last so many years with things like the measles vaccine and other vaccinations. And it's been steadily increasing. So it's definitely something we're going to need to address.
Absolutely. And, to the point about community outreach and disparities with the vaccination rates in several neighborhoods where, residents are predominantly people of color and more impoverished. Have you seen any improvement on those numbers as a result of, the outreach and the public service announcements that you've been doing in those hard-hit zip codes?
So the one that we have the most familiarity with, let's see if I can talk, is the 85009. So, we did that targeted outreach where we went and actively enrolled people, got them, scheduled at the vaccine pod. So we know that we were able to get 400 more than would have been gotten had we not done that outreach. But it wasn't as big as we had hoped. I mean, we would like to see a significant increases in that. We did see a small increase in the number of vaccinations that occurred in that area. But we are going to expand those efforts into the South Phoenix area to reach more of those communities.
Perfect, thank you.
Welcome.
Stephanie Ennis.
Hi, Stephanie.
Dr. Christ, I just wanted to expand on Lorraine's last question about those communities with low uptake. There was that $1.2 million contract. It mentioned 14 zip codes.
Mm-hmm.
Do you think that was the most effective way to really boost vaccine rates in those zip codes, looking at it now?
In some of those zip codes, yes. I think, that targeted campaign, that had specific assets that were developed for that community in a culturally appropriate manner. And so, we did those town halls. We were able to answer one-on-one questions. We will continue to do that because these are vulnerable communities. I think that it was a good effort. I, of course, would like to see everybody vaccinated. But we were able to increase the vaccination rate in that 85009, and now we will be expanding and doing some of those same activities in multiple other zip codes.
Great, thank you.
Welcome.
Next is Hank Stevenson.
Hi, Hank.
Dr. Christ, I appreciate you making the time. I'm following up on those that last line of questioning here. I look at the numbers in 85009, and it is still the least vaccinated zip code in Maricopa County, at least according to Maricopa County's dashboard.
Mm-hmm.
I guess the question is, are you confident that the public got its money worth? And then on top of that, you talked about expanding this to other zip codes. I'm sure you saw the report last night criticizing this thing for going as a no-bid contract to somebody who has worked for the governor in the past. Will Mario Diaz be in charge of this if it is expanded, when it is expanded, I guess I should say?
So it has been expanded. We are continuing to work with Mario Diaz as a partner. He is a trusted community member in that community. And so he is working, I believe it's City Council districts 6 and 7, to really get into those communities. I think, it's always hard because when you're looking at it from a state population, it's these huge numbers. But I think even getting one more person vaccinated and saving a life is worth the effort. And trying to get out into these communities that are vaccine hesitant or can't get their questions answered and be able to provide on the ground direct communication, I think is highly important. And we continue to look for partners who we can work with. Equality Health has come to the table, Arizona has come to the table, and we're partnering with them to do as much as we can for outreach in those areas. And that's in addition to all that our county health departments are doing as well.
Okay, if I could, you earlier said that there were 400 more people who would not have gotten vaccinated if not for this program.
Yeah.
I guess I question how we know they wouldn't have gotten vaccinated. And you mentioned that it's not as big as you hoped. So I guess one, just kind of circling back, 400 people for $1.2 million doesn't seem like a great ROI in my mind. If there are going to be more partners for this kind of effort, are we going to go through a proper bid process in the future?
So there's a couple of different efforts. So that was a competition in practicable, which has been done for many contracts throughout the emergency. And so those 400 that I'm referring to, the 1.2 million was not used directly on those 400. Those 400 are the individuals that I am specifically aware of that we had outreach to that had not signed up yet, that we provided direct registration services for, and potentially provided transportation. We didn't provide transportation for all of those individuals, but those were the ones that we actively worked to get appointments at our Phoenix municipal site. And a lot of them did tell us that they wouldn't. I vaccinated some of those individuals myself, and they were very thankful. So I think that was a good outreach. That's the only reason I have that number, but we know that there were many more that were vaccinated in that area from the education and from some of those services that we provided.
Okay, and will the rest of these contracts be going through full RFPs?
So it depends on, what that activity is and how we're going to pay for that. Right now, there is an invitation for bid. It's an IFB that's out for vaccination services that's open, I believe, through March 19th. That people can apply for. So that's one process. That's where we're looking for people who can provide vaccination services out in the community. But there's all kinds of different opportunities that we have here at the department. And so there may be things that we need to do a competition and practicable for versus an IFB or an RFP.
Okay, thank you.
You're welcome.
Hey, Cara, I gave you the wrong districts. It's 7 and 8.
Oh,
My
I'm sorry.
apologies.
Okay, it's District 7 and 8. So, sorry.
My bad.
No, that's okay.
Everybody, I'm sorry, we're at 2 o'clock and a couple minutes over to take care of our technical glitch, but we'll have to, the others with questions, please email us. And thank you for your time, Dr. Christ.
Thank you, everybody, for joining us today.